Recovery doesn't stop once you've completed your initial course of treatment. It's actually the segue into living a life of recovery, and having a structured relapse prevention plan in place is a really safe and supportive way of helping you transition from that therapeutic care back into your life, back into your world. Now, my name is Dee Johnson, and I'm the Senior Addiction Therapist at Priory, Chelmsford. And I'm here today just to help explain to you what your relapse prevention can look like and how it will support you. So we often get asked what actually is a relapse, and by the time you've got to the point where you've placed your bet, picked up your drug of choice, drunk your drink, whatever your addictive response is, the relapse happened way before then. The relapse actually happens in our thinking, because that's the bit that leads us to picking up that drink, drug or behaviour. We call it stinking thinking, and if I'm not addressed that, then I am on that pathway to using. So it's really important that when we look at relapse, it starts in your head. It starts with you not dealing with your feelings, withdrawing, isolating, maybe not going to meetings, not seeing a therapist, not dealing with some of the life pressures, not dealing with maybe even flashbacks or recalls, or even euphoric recall when you kind of get those rose-tinted spectacles about, well, maybe I could just have one, and you're not being honest about it. Relapses can then be what we call acting out. So, for example, if you're a gambling addict, you might not be placing the bet, so you're still telling yourself you're clean, but you're now looking at the fixtures of the latest race or sports day and you're working out what the odds could be. And that's kind of what we call dry using behaviour. So that's another sign that relapse is coming. You think I can just skirt around it, but if I don't pick up, I'll be all right. And again, you're not being honest that that's taking you to a vulnerable place. So by the time the physical relapse happens, it can feel a shock to other people. But in reality, relapse kind of happens way before the picking up. And it's always a gradual thing. And it's nothing to be ashamed of. It's a very human reaction. It's not mandatory, or you've got to relapse to get recovery. It's your personal journey. But if you can flag it up before, or allow someone else to front it out with you and say, oh, I've noticed you've gone really quiet. I've noticed you don't socialise as much, or you're not seeing your sponsor, or you're not going to a meeting. Just take that as a really loving, caring support, not an attack on you, because your addict head will see that as an attack, and realise, yeah, I could be on a slippery path here to a relapse. Relapse prevention plans are absolutely key to have that structure and idea in place when you first learn about your addiction, and that you can have a choice in how to manage a life of sobriety and being clean. Now, that relapse prevention plan, it's really good to write it down. It's really helpful to get advice and recommendations from other people in recovery, or your therapeutic team, or people in your support groups, because they'll think of things that have worked for them as well that you might not be aware of, and you can try it out. The thing about your relapse prevention plan is it has to be structured, but don't make it so rigid that you're petrified that if you just drop one thing of it, you're going to fail. And it's a fluid thing, because as you gain confidence, as you go more into your journey of recovery, things will change for you. You'll learn more. Your circumstances will change. So it kind of needs to flow a bit as well, which is why it's always, if you like, a work in progress document. Don't just, this is my relapse prevention plan and I've got to stick to it. Learn to be flexible with it as well. We talk about setting recovery goals, and I think you need to be careful about that, because in addiction, your self-esteem and your shame is just, your self-esteem is shattered and the shame is so prevalent. If you set too many goals, you'll set yourself up to fail, and that addict stinking thinking will just come roaring in, fill you with shame, self-pity, blame, self-hatred, and that will give you permission to pick up a drink. So nice to have targets, but again, don't make them things that you can fail on. We just say, just for today. If you haven't smashed yourself up today, and even if it's been a really rough, hard day, because life stuff happens and difficult things happen, and even if you thought about picking up and using, but you still didn't, and you put your head on the pillow and you were sober, that's a part of your recovery plan. You've had a good day. So some people find it, helpful to have milestones, doing 90 fellowship meetings in 90 days, or reaching 100-day sobriety, or 6 months. And that's absolutely great. Just be aware that can also be the thing that trips you up, where the addict thinking can be very cunning and says, well, you've done 6 months, well done you. Why don't we have a little drink as a reward? So when you're setting your goals, see them as just milestones of moving forward, not as, I can reward myself on this. I've seen it too many times. If you set too rigid goals, you can set yourself up to fail as well. It's just a day at a time. What do I need to do to keep well? And how can people around me understand and support me on that? So when you're in recovery and when you go through the therapeutic process, it often surprises people that so much of it is about learning to dealing with your feelings and your thoughts and how you react to things. Recovery is about learning how to respond to things, not react, because as an addict, your impulse reaction will be to pick up and use and self-harm yourself. So you're learning slowly to respond to things, to hit that pause button before your knee-jerk, schematic response to self-sabotage. And that's okay. Sometimes it comes quickly, sometimes it comes slowly. So it's really, really vital to kind of keep up that psychological self-care and psychoeducation on how your mind works, what your triggers are, what past issues you might still have that reaction to, what angers, resentments, upsets, trauma you're still holding on to. And it's a process of learning with therapy, with supportive people, to talk about it, learn about it, take control of those thoughts, because most relapses come from not being able to deal with the difficult emotions. How do I know if I'm relapsing? I know I don't feel well in my mind. I know that discontent, that feeling of dis-ease within me, and I know I need to do something about it. If I deny it and I avoid it, I'm ignoring my relapse prevention plan and I'm on a road to relapse. So that's when you start sharing with people, doing your daily diaries, getting out how you feel, therapists, whatever has worked for you, keep it up. But be aware you're human, it's going to happen. But catching those thoughts before your addict head takes over and justifies why you can drink is absolutely key. People think because they've not had a craving, they've cured their addiction. And it can get you left field. It can come at you with a curveball when you're in a good place, not even thinking about using, no issues, and bing, that addict thought comes up. You could have just one. Put one bet on, one cheeky little line, one drink, whatever it is. They're just thoughts, and thoughts are not facts. Your addict thinking will want to make it into a fact, but just recognise, first of all, if and when that craving happens, it is just a thought and it will pass. That's when you pick up the phone to somebody else who understands addiction. You might want to distract yourself by, going out for a brisk walk, putting some ice cubes on your wrist, saying it out loud, I'm craving, but that's okay, it will pass. It's really important that at some point in that day you reach out to somebody and you share it, even if it's just a quick flash. It flashed across my head. You've used for years. It would be pretty strange if occasionally those craving thoughts didn't come into your mind, not just because you're having a bad day or something bad's happened, because it will just pop up. It's that neural pathway that's been built in your brain. It will just flash up sometimes. Most important thing is it is just a thought. Try not to panic, but what you don't do is deny it, diminish it, brush it away and think it will go away. If you voice it and call it out, it will take the power out of that thought. And if you don't do that, it will just keep ruminating and spinning around in your head. If you can ride that storm for a good 15 to 20 minutes, you're giving yourself a good chance that you won't pick up. It is just a thought. It creates that feeling, that urgency to use. And remember, emotions, the clue is in the word motion. It will move away from you. So having preventative coping strategies and a support network in place for your recovery is vital. And I think what's important here is how we mentally approach a relapse prevention plan and actually approach looking after your recovery. Try not to look at it with fear and dread, like, I've got to do this every single day. My life is going to be filled of, have I done my inventory? Have I called my sponsor? Have I checked in with my therapist? Have I exercised? Recovery gives you freedom. The only one thing you can't do in life now is pick up. But you got recovery, you can do everything else. And there's a joy in that. So if we approach recovery and your recovery and relapse prevention plan with excitement, with joy, the freedom it's going to give you, the freedom of thought, the freedom of struggling with your mental health, your finances are better, your health are better, your relationships are better. Just because you've got to do a few things a few times a day, is that really such a burden when you think about how much your life was taken over and destroyed by 24/7 addictive behaviour. It's just a few things every day to give you your life back. And I think that's really valuable, to have the right approach, not, oh, I've got to be in recovery for the rest of my life. No, just for today. Look at your recovery as, what do I need today to look after myself, not self-harm, not self-sabotage. So just to help you understand that there's a lot of support out there for you. So when we talk about seeing a therapist, that can be in the group therapy or the one-to-one therapy you may have experienced. And to keep that going regularly. Group therapy is really, really impactful with addiction, because you realise you're not on your own, and just sharing that shame and that heartbreak and the scary dark places it takes you to, and seeing the hope and inspiration in others that they've been at rock bottom, and seeing what they've managed to do day at a time to get their recovery really helps you along the way, because it's real time. These are not people just telling you what to do. They're doing it right in front of you, and they will support you along the way as much as you are them. So support groups, group therapy, really, really impactful on a positive relapse prevention plan. The 12-step fellowship program, Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, and so on. They have people called sponsors in there, and sponsors are people that have worked the 12-step program. They are, if you like, support buddies. They are there to guide you through the process, guide you through the work that they do. There's other support programs as well where you have sponsors or buddies. And these are kind of mini gurus that have been there, seen it, done it, and will take you through a process of maintaining that daily recovery. And to be honest, you kind of need a bit of everything. Your addiction took over every aspect of your life. You need to grab every bit of recovery learning that you can, every bit of support group. And it's the best free education you can get, because they're going to tell you what it's like when you get out of rehab or your regular therapy sessions, what life's going to throw at you, what worked for them. And there are certain milestones that can put you in a vulnerable state. And often we see the year's milestone. So your addict head will go, well, you've done the year. And other people who don't understand addiction might even say to you, well, you've done a year, surely you can use now, surely you can have a drink now. And your addict head will be up for that. And so being around people that have done that year and more will say, yeah, that can be a wobble for some people, but you think you've got this magical cure that isn't there. And they'll guide you through that wobbly time, just to remind you, yeah, we felt that too, but push through it. It doesn't work like that. So it's really key to your relapse prevention plan that you do surround yourself with people that have been through it and understand it personally and professionally, because as much as we've got wonderful loved ones, if we're lucky enough to have them and support, you just need that understanding of the addictive thinking and having that separate support group. Your family can't be the reason you've got recovery, because you'll put too much pressure and a burden on them. They are the bonus that you get that love back, but they cannot be the reason. Don't put all the burden and responsibility on them. When you're in the grips of addiction, you know that dishonesty just is rife. It's through you. You're lying about how you feel, what you're doing, how much you're doing, where the money's going. You're lying about how fearful you are. It's just a horrible vice to be in. So the flip side of that, recovery is all about honesty. And you've got to get honest with yourself. Addict behaviour, there's a little bit of a thrill in when you were in the using stages of getting away with things, because that's an addictive response in itself. Oh, I fooled everybody. Nobody knew I was using. I got away with that. That's a bit of a dopamine flood in itself. And whoever you've got to be honest with, that safe person, whether it's your therapist, trusted friend, partner, sponsor, someone in your support group, make sure you keep owning that stuff with yourself, because relapse can come in so cunningly, and that's including the behaviour. I'm getting away with things, I'm burying things, I'm in denial again. So there's a brutalness in how honest you have to be with yourself, but what that brings is real care and release from any angst. Well, as much as you might have your relapse prevention in place, relapses can happen. And that's, it does happen. That's okay. Don't beat yourself up for it. Reach out for help as soon as you can. Own it. Tell somebody. But the brilliant thing is here, you've not got to start from square one. You've got that strategy in place, and you know it's worked before. And maybe there was something you stopped doing that you think, actually, yeah, because relapse is often about what we stopped doing, because I felt okay, I did negate reaching out to people or exercising regularly. I stopped caring about my diet. I started isolating. I wasn't doing my daily inventory, whatever it is. The brilliant thing is when you first get into recovery, it just seems so overwhelming and a minefield of what do I need to do to keep clean. If you relapse, you've got all that learning. And the key thing is you can't undo the recovery time you had. That shame and that guilt will beat you up and say, I've gone back to square one. But you can never undo your clean time. You had it. You worked for it. You took the next right step. You had that relapse prevention plan, and it's still sitting there waiting for you. There is no shame in relapse. And you often help other people by sharing that experience. And it might just be the foot brake they needed before they were going down that same pathway of relapse.